And once again, as advertised, I guess, we welcome in Dr. Tim McKnight. Good morning. You brought some help today. That's good.
Yes, I did.
Research is great.
Cheat sheet here.
Because we're kind of covering a lot of different little topics under the same umbrella about screenings. Like what should a person get? I'm sure there are different times in your life when you might need different things, but can you kind of explain? These are what, preventative measures for the most part?
Exactly. So there's two things we're talking about often this time of year. One is the blood screenings that many hospitals, communities offer, and so I think that's really important for probably anybody over 40. They should have that probably once a year. Some people like to do it twice a year, but those tests are pretty much routine. So it'll check a complete blood count, make sure your blood counts are okay, your platelets are okay. That can be a screening for anemia. It can be a screening for certain blood cancers. But most importantly, I think, is when you compare these from year to year, if you see changes, then that's something that you need to be aware of. And these are really good to turn into your primary care provider so they can have these in their records. So the complete blood count is one. The comprehensive metabolic panel looks at your blood sugar, fasting blood sugar screening test for diabetes, looks at your kidney function, liver function, protein status. Those are important. And then most of the screenings will throw in a lipid profile, looking at your cholesterol levels. And we've talked about the value of cholesterol in the past. People like to see that because they worry if their cholesterol is high, it might be a risk factor for heart disease, which it is, but not the most important risk factor. But when I see the cholesterol profile, what it tells me is about their nutritional habits. If their triglycerides are high or their LDL, which is the bad cholesterol, is high, or their total cholesterol is high, they're probably not eating as good as they should. And so that's helpful. And then many of the communities who do these lab tests will offer additional tests that you can pay a few dollars for, maybe a vitamin D level, which is sort of a hot topic, a PSA, a prostate screening test for men. Some will offer a C-reactive protein, which is an inflammatory marker in the arteries, kind of a secondary risk factor for heart disease. So those are what these community screenings offer, and they're great because they usually make these affordable for the community. And they can be really helpful, and people like to see that everything looks good. But most people don't have all these tests, all these numbers come back in the normal range. There's often some deviations on one end or the other, and it doesn't necessarily mean a bad thing, but it's often what propels people into their provider to say, geez, I'm worried about this. What does this mean?
If I go to one of those, how would you, as my primary care doctor, get that information? Will they send that automatically, electronically? Or
that's a great question because they don't know. They'll send you usually two copies, one for you and one for your provider. So you have to take that in the next time you see your provider or drop it off sometime. But no, they don't send it to us. So we're kind of in the dark, and so we get a copy of it, and then we scan it in your chart. So those are the annual blood screening tests or semi-annual blood screening tests that many communities offer. The other question that you started with is the screening tests. These are screening tests for cancer. We screen for heart disease basically by the cholesterol profile, and then when you see your provider, we're looking for the risk factors of strong family history, high blood pressure, diabetes, smoking, and high cholesterol. That kind of tells us what type of a risk factor you have for heart disease. But for cancer, which is what a lot of people are worried about, there are tests that we can do to screen you for these cancers. But you would be surprised that there's only a handful of cancers that we can effectively screen for. And the idea with these screenings is we want to catch the cancer early enough that we can do something about it without doing harm. So to do a full body MRI from head to toe looking for any cancer anywhere is a really bad idea. And the reason is many of us will have blemishes inside our body just like we have on our skin as we get older. And if we start poking and prodding and sticking needles into biopsy things that don't look normal, there's a risk that we're going to cause problems. And it's going to lead to more procedures and more biopsies and more interventions. And at the very end, we find that this was nothing.
Yeah.
But the risk of causing infection or other complication goes up.
And that costs money.
And it's very expensive, right? So there's these committees that meet regularly to look at all these factors and say, hey, if we do a colonoscopy starting at the age of 50, we are likely to catch it early enough to be able to intervene and have a good outcome. If we start at the age of 70, no, that's going to probably be too late. If we start at 35 or 30, probably way too early.
Yeah.
So it's carefully thought out. It's debated every time the experts to get together, and they even rate these by grades, the screening tests. So though a grade A recommendation, and this is from the United States Service Task Force, Preventive Service Task Force, they grade these by how likely is this to be helpful. So a grade A recommendation means that there's a high certainty that the net benefit is going to be substantial. Like, you really should do this. Colonoscopy is one, a mammogram is one. Then there's a B recommendation that says that there is high certainty that the net benefit is moderate, or there's moderate certainty that the net benefit is moderate to substantial. So maybe not as convincing that this is the right thing to do. And then there's a grade C that says we're not as certain about this one. Grade D means we really recommend that you don't do this. And then a grade I is there's not enough information for us to make an assessment. Mm-hmm. So the screening tests that people should think about, number one is a colonoscopy. Now, people can get confused by these recommendations because there's different groups. So the United States Preventive Service Task Force is what many primary care providers follow. So when we're talking about mammograms, the age for that starts at 50, and it goes every 2 years to the age of 70. But if you follow the recommendations by the American College of Obstetrics and Gynecology, they say the mammogram should start at 40 and should be every year until the age of 70. I like that recommendation. I think starting early and doing it every year, there's very little risk of harm with a mammogram. The worst thing is that the radiologist will see a shadow or something that they're not completely certain on, and they'll recommend a follow-up in 6 months, or maybe an ultrasound, or maybe an ultrasound-guided biopsy. So it scares a lot of women, and it puts them through a little bit more emotional turmoil. But what we're trying to do is catch a breast cancer early. Mm-hmm. And so those mammograms are really useful. I like the start at age 40 every year to the age of 70. Then what do you do at 70? Well, that's a discussion you have with your provider, because some people, their health is great at 70. If there's a breast cancer, they'll go in. They're expecting to live another 20, 25 years. Let's go get it. I'll do whatever it takes. Other people at 70 will be like, I've been through a lot. If there's a breast cancer there, I'll just take my lumps and live with it as long as I can. So those are personal decisions that you make with consulting with your primary care provider. So the mammogram is one. The colonoscopy I mentioned, some places like to start it earlier, especially for those people who are at risk because of a family history. We'll start it before the age of 50. And it usually is every 5 to 10 years. If we don't find anything at 50, we'll often recommend that you come back in 10 years. Colon cancer takes a long time to grow, but if you catch that early polyp and remove it, boy, you come in, you're bleeding from your bottom or in the toilet. 2 years later, I can tell you confidently you don't have colon cancer. You have some other cause of bleeding. Yeah. But if you're 55 with blood in the toilet, I'm not positive, and I'm going to say you've got to have a colonoscopy because we got to figure out what's going on. So we can screen for breast cancer effectively. Those are grade A recommendations. We can screen for colon cancer. We can screen for cervical cancer. So we do the pap smears. And some places say start at the age of 21, and you go every 2 or 3 years to the age of 65, which is a nice change from where it was 20 years ago, because 20 years ago we were doing pap smears on 80-year-olds. And that was not the most pleasant screen for either the provider or the patient. So we go till the age of 65 for those. We have a fairly new recommendation for people for lung cancer, and those are people who have been heavy smokers. So if you smoke, we call it a 30-pack year history. So you smoke a pack a day for 30 years. That's a 30-pack year history. Mm-hmm. If you smoke 2 packs a day for 15 years, that's a 30-pack year history. So in other words, a fairly heavy smoker for an extended period of time, starting at the age of 55, we can do a low-dose CAT scan of your chest, so a low radiation level on the CAT scan to screen for lung cancer. And this starts at the age of 55 and it goes till 80. that's also really good for people who are in this category. So we recommend that because those people are usually worried about it. They know they shouldn't be smoking, but
Right.
they're not stopping, and they worry about this lung cancer. So that's another good one. The PSA for prostate cancer, that is no longer recommended as an effective screening tool. Yet many of us still do that. I think there's a great utility in that. The recommendation is for men over the age of 50 to have a rectal examination every year. No man likes that. Many providers don't like to do it, and I don't feel real confident that a small finger pushing inside a man's rectum, feeling the back of their prostate, and only maybe touching maybe 15% of the surface area of the prostate, I don't know how that is reassuring. But most of the prostate cancer is in that area where you can touch it with a finger. So if it's a lump or a nodule, then we get concerned. So that's what we're supposed to do. I still think the PSA is a great screening test, but we don't overreact if it's elevated. There's a lot of things that we can do to reassure ourselves that that's okay. For the prostate cancer, if you're following the PSA, there's this thing called the velocity. How fast is that PSA changing over time? This is one of those, I'd say, every year, if you're a man, go get your blood tests, the screening tests I was talking about earlier.
Mm-hmm.
Check that PSA and chart that every year. If it's a slow, gradual increase, you're probably okay. If it's gradually increasing and then the PSA jumps, that could be a sign that there's a problem. And you don't necessarily panic, but you don't overlook that. You go talk to your provider or you go see a urologist and you make sure everything's okay. So we've talked about breast cancer, cervical cancer, colon cancer, prostate cancer, and the next cancer is skin cancer. And we used to recommend an annual skin examination by your primary care provider, and that's not recommended anymore. So and I'm not sure why that is, because I think that's a pretty good test. But what happens is many providers are not real skilled at picking up these cancers when they're very early. Now, melanoma, most providers will see that because that's a very aggressive one.
Mm-hmm.
So there has to be benefit. We have to be able to find the problem early enough to make a difference without causing the patient a lot of anxiety and complications because we're digging and searching. So those are the cancers that we're screening for. We don't have a screening test for brain cancer. We don't have a screening test for kidney cancer or stomach cancer. So that's why, every healthy person should go in every year at least, see your primary care provider, have a full examination, talk to them about any symptoms, and just stay in touch with them. And a lot of people that are healthy, it's almost like they're allergic to the doctor's office, or they're saying, I'm fine. And they don't want to admit or recognize that someday they may not be fine. And they just keep putting it off. And I'm one of those. But it's important to do that. It's just like a car. Maintain your car. Make sure even when it's running well that you have things checked out periodically. So I think that's the take-home message. So there's blood tests that help us kind of detect things early, and then there's these screening tests for cancer.
And then there's questions you might get a good answer if you ask a question. Hey, I've been having this pain or something, but if you don't say anything, you don't know if that means anything.
Yeah, I can't tell you how many people have developed pancreatic cancer with a little pain, and they kind of put that off. And sometimes that's a tricky diagnosis early on, and it's a tough one to recover from.
Yeah.
But that's the reason you don't blow these things off. I mean, unfortunately, after you hit the age of 40, for most of us, these things can start creeping in and go unrecognized. And you don't want to be a hypochondriac, but on the other hand, you don't want to blow it off. And some people just prefer, hey, as long as I don't know this is what it is, I don't have it. And that's kind of an unusual mindset, but it's not the best mindset if you're trying to be proactive and maintain good health for a long time.
I would call that the ostrich syndrome.
Yes, it is.
Well, Dr. McKnight, thank you.
You're welcome.
And again, contact your provider and get those tests, right?
Absolutely.
Dr. Tim McKnight this morning.